So what's going to happen is I'm going to share my screen and start the slide deck. Laura, when we get to the double AMC slides, feel free to turn on your audio and you can just say next slide and I'll just advance it for you because it's all part of the one slide deck. So we don't have to try to turn off my share screen, turn on your share screen, and just all the shenanigans that could happen. All right.
Okay. Oh, for my slide, do you have the one with the QR codes towards the end of my deck?
Let me just double check right now.
Okay.
Because I know you sent the updated version.
Mm-hmm.
Yes, I have it. There's
Okay,
like
perfect.
supplemental ERES application data reports, what's new, and my ERES application.
Okay, and do you mind, I couldn't access it to edit it, but do you mind changing 2024 to 2025 on the above the QR codes?
They're already at 2025.
Okay, perfect. Thank you.
Of course. Hello, everybody, and welcome. We'll just get started in a couple of minutes. If you are not on the panel, would you mind just muting and turning off your video? And we'll be starting shortly. All right, everybody. It is about 3 minutes after the hour, so let's get started. Welcome to Applying to CL Psychiatry Fellowships in 2024, a virtual Q&A presented by the Academy for Consultation-Liaison Psychiatry, ACLP, and the American Psychiatric Association, APA. This webinar should be recorded and will be posted online for later viewing, and all the prior years of this are online for viewing as well. So overview of webinar, we're going to take about 15 minutes to talk about why CL Psychiatry, an overview of the application timeline and process, as well as like previous years of match data. We're also going to have a special guest, Laura Constantine from AAMC, give a quick refresher on ERAS for y'all. And then we're going to go introduce our Q&A panel and spend the vast majority of the time just in live Q&A with y'all. We're going to take a mix of questions y'all sent in registration ahead of time, as well as we can just do typing questions, Q&A, and then we'll answer for them for you live as well. So in general, why CL Psychiatry? And part of the reason we love this field is because there's so many facets to it. All of y'all know about like inpatient consults, like general hospital psychiatric consults on the inpatient setting, but there's also emergency psychiatry and outpatient settings, women's mental health, psycho-oncology, transplant psychiatry, addictions consults, pain psychiatry. Basically every facet of medicine has an aspect of psychiatry that's then seen by CL Psychiatry. In addition, there's a huge impact of diversity, equity, and inclusion on CL Psychiatry. Patients with psychiatric substance use disorders are underserved in the general medical system, and the minoritized and underserved populations are underserved in our mental health system. So CL Psychiatry can really serve an important role in addressing both these disparities, because we play an embedded role within the larger healthcare system, and we're often an entry point for vulnerable patients into mental health treatment. We also provide a lot of opportunities for advocacy and education of physician peers and healthcare staff. So why CL Psychiatry Fellowship? Well, first, it's required to sit for the ABPN board in CL Psychiatry. It's an additional year transition from trainee to attending. You get sub-specialized training in a lot of really cool niche areas in psychiatry, including women's mental health, psycho-oncology, transplant psychiatry, and you get exposure to a lot of new models that you may not have had a chance to medical school and residency, like embedded clinics, collaborative care models, e-consultation, proactive consultation. So a lot of ways to learn how to do things in new ways. So a brief overview of the timeline. Really, this month and next month, June, July 2024, you want to be contacting programs inquiring about CL fellowship positions, asking the questions that you want to get asked directly to them. From July to September is when you're completing and sending out CL fellowship applications, and it's a rolling cycle. From September to November is going to be fellowship interviews. And then December 18th, 2024, NRMP rank lists are due for both applicants and programs, and we'll get into that in a little bit. And then January 8th of next year, you'll have the CL fellowship match. So this question came in a lot under registration. How do you decide where to apply? There's a lot of different things. One is just geographic location, reputation, like of the fellowship, but also the residency department, the medical center, the number of fellows they have per year. Do you just want to be one fellow? Do you want to be a group of 2, 3, even 4 per year? Looking at the consult volume, workflow, and team composition. Think about the clinical experiences you'll have, both inpatient versus outpatient. Asking if they have any specialized system on didactics and extra clinical opportunities. Thinking about academic time, reimbursement for educational costs, opportunities for research and teaching. What's their policies for time off, like vacation, illness, parental leave, and conferences? What are their well-being resources? What is their culture on diversity, equity, and inclusion? Are there specific faculty and supervisors you want to work with? And also, what's moonlighting? Like, life isn't getting cheaper, and many of y'all have loans to pay off. So moonlighting is a great opportunity both to make money and also learn how to attend. So continuing on in this application season, CL fellowship programs will have the option to use either the ERAS application and or their own specific institutional application. So we're going to be talking about institutional application on the next couple of slides, and then Laura will be talking about the ERAS process later on in this talk. So the old school, which a lot of programs still accept, is the institutional application materials. So things that often use, there's a common CLP fellowship application, which is a document you can fill out, you can access actually by the ACLP website. And some institutions still have their own application forms that they need for all of our GME applications. They'll still ask for a personal statement and a CV. You'll want 3 letters of recommendation, including 1 from your residency program director. Often they'll ask for licensure forms like your state license or DEA license of where you're currently practicing. Some will ask even for your medical degree and your medical school dean's letter. You'll want your USMLE or COMLEX score report. And for international applicants, you'll want the ECFMG certificate and visa paperwork if applicable. A special note for Canadian residents, if you've passed the licensing exam requirements in Canada, you are eligible for USCL fellowships. This is an example of just like an email you can send to programs in June and July of this year. But contact each program you're interested, do a brief and professional email indicating your interest, and request any additional information and or application materials. Like, do you prefer ERAS institutional application? Do you want separate files, one big attachment for materials? Do you need visa information up front? So this is an example email. Dear Dr. Shah, hello, hope this finds you well. I'm applying for CL fellowship this summer. I wanted to email you with my strong interest in Brigham's fellowship. I also wanted to ask you, please send me any formal application materials and requirements as directed on the website. Looking forward to applying to a fellowship. Have a nice weekend. Sincerely, me, from 2018. So, the timeline for interviews. So, ADPERT is continuing to recommend virtual interviews for psychiatry, including CL psychiatry. So, you're going to be wanting to ask at a time, like, what are days off? Like, will you need to take interview days or academic days versus vacation days for your interview days? Interviews go out on a rolling basis, so reply promptly in the August-October timeframe. From September to November, the vast majority of interviews. So some general tips: ensure a quiet place with good Wi-Fi and lighting for virtual interviews. Create a list of questions you may want to ask during the interview. Keep a copy of your application for each program. Know what you said. I had a greatly embarrassing experience once where I wrote something on my application, promptly forgot I wrote it, and then an interviewer asked me about it, and I was like, oh, did I do that? And then made me look real dumb. So don't do that. A hot tip is to keep PDFs of your CV and publications if available, so you can send to interviewers. PDFs are just easier to attach and read from email. And of course, be sure to thank the program post-interview. So the ranking and match process. So regardless if programs are taking the ERAS or a standard application, all fellowships use the NRMP match process. So you want to register or re-register early for the NRMP match. So on October 16th, the NRMP, which is separate from ERAS, the match opens. In November 6th, the rank list opens. So after interviews, send your NRMP number to programs so they know how to rank you. By December 18th is the rank order list deadline for both applicants and programs, and January 8th of next year is match day. So after match day, congratulations, you matched. You want to be thinking about what is the start date of your fellowship orientation versus your finish date of residency, especially if you're still in residency right now. You have to think about, are you going to need permanent licenses, especially going to a new state? Is a DEA mandatory to be a fellow there? And if you're relocating, think about housing, like buying versus renting, neighborhoods. Are you going to need a car versus taking public transit? What are the benefits like healthcare, vacation, disability? You may need to be finding a new doctor, dentist, therapist, bank, childcare, house of worship, etc. Is there a moving allowance? So reach out to current fellows and faculty for advice. That's super helpful. Just some quick data we've collected over the past 10 years. So the big picture take from this is the number of CL fellowship positions continue to increase, as well as the number of applicants, but there's still more positions than applicants. And we still don't manage to fill them all. So, and most applicants still get their first or second choice, even as CL gets slowly but surely more competitive. Another thing to think about is from a demographic diversity perspective, comparing 2023 to 2019, we're having slowly increasing diversity within CL fellowship applicants, but there's still a lot more work needed, especially in reaching out to minoritized and underrepresented populations. Here's some additional resources for prospective applicants. The AP has a CL Psychiatry homepage, as well as a whole council on CL Psychiatry that answers CL-related questions. ACLP has a whole residence fellows section, which has a guide on becoming a CL fellow, a directory of match participating CL fellowships, and the common fellowship app which we're talking about. There's the ACLP trainee mentorship program for residents, which is due August 31st. Coming up soon is the ACLP Trainee Travel Award, so you can go to the fall meeting in Miami, as well as the Web Fellowship, which is a great opportunity to learn more and get involved in ACLP. ACLP also has an early career psychiatrist ECP interest group and listserv to get more information. And there's even a CL Psychiatry Facebook group called CL Pen. So I'm now going to turn it over to Ms. Laurel Constantine. She's a senior ERAS training specialist at the Association of American Medical Colleges, and she's going to give a refresher on ERAS.
Hi, everyone. My name is Laurel Constantine, and today I'll be presenting on the MyERAS overview. And next slide, please. So today we'll go over applying to ERAS, the MyERAS application content highlights, as well as any resources. And I will also be putting resources in the chat after the presentation. So ultimately, the ERAS application is designed to streamline the residency application process for applicants, their medical school's dean's office, letter authors, and programs. So in short, applicants apply to residency or future fellowship programs using MyERAS. ERAS sends the application and supporting documents to the programs. And lastly, the programs receive the applications and documents for reviews. So it's a straightforward concept, but you can already tell there's various tools for our different users. And next slide. When we talk about the components that make up ERAS and the respective users, from left to right, we have future applicants such as yourself who apply to residency and fellowships using the MyERAS application. Then we have our medical school staff and dean's office who utilize DWS, also known as the Dean's Workstation, to upload supporting documents for your application. And we've got our program users who utilize the Program Director's Workstation, also known as PDWS. So in PDWS, they'll eventually review your applications. And last but not least is the Letters of Recommendation portal, or LORP, where the authors that you submit your letter of recommendations to, submit those letters for you to then later assign to your programs of interest. And next slide. While there are many ERAS users, I would be remiss not to take a quick moment to turn our attention to the stakeholders we work with to bring all of these pieces together. I won't touch on all of these individually, but the point I want to make is that if you have a specific question about the process, please make sure you contact the right organization. So for example, if you have a question about your USMLE exam, you would contact the NBME, just for an example. And the next slide. So on screen, you're seeing a broad view of the ARIS application process. Although it is a little simple, but I will highlight the main points of the process and share you the relevant resources due to the fact that there are many parts going into this application process for applicants. And next slide. So starting at the top of the key and the beginning of the season, designated dean's offices or your DDOs issue tokens to prospective applicants. And for fellowship applicants, you would actually go to the EFDO, ARIS Fellowship Documents Office, to receive your tokens to then apply to programs. Then we have applicants register their tokens to gain access to the My ARIS application. And then applicants gather supporting documents. And we do have three tips to keep in mind. First, you would want to pay attention to our timeline and keep an eye out for our website updates on other key dates for the application process. Secondly, when you register your token, you'll start to receive communications from us. We include targeted and strategic information to support you throughout the season, so be sure to read our emails. Lastly, ARIS will host a webinar on June 25th with more in-depth information on the application. And registration is currently open for that webinar, and I can also drop that link in the chat as well. And next slide, please. When preparing your supporting documents, these are considered standard ARIS application documents and should be sent through the ARIS system when an applicant is applying to a participating ARIS program during the recruitment season. The steps to send each document can be fairly straightforward, but there are instructions both in the system and in various resources to guide you through the process. For instance, this chart here is actually from our ARIS checklist on our student website. And as I mentioned before, I can put all of these links in the chat for your convenience. And next slide. So here we have the summary for the experiences section. First, applicants can now focus up to 10 experience entries to showcase their identities and priorities. They can designate and describe up to 3 meaningful experiences with a short description. New experience types are available with more detailed information for each entry. Applicants can highlight the mission-focused characteristics of their experiences by selecting the setting, focus area, and key characteristics. For impactful experiences, applicants have the option to describe challenges or hardships that have influenced their residency journey, including family background, financial background, community setting, educational experiences, and general life circumstances. And next slide. So here we have a screenshot of the fields when adding an experience. So as you can see, it is mostly drop-down menus, so there is less free text available. And next slide, please. So here we have our geographic preferences. So geographic preferences, including division and setting, is a part of the biographic information section in the My ARIS application. Applicants can indicate up to 3 U.S. Census divisions, express no preference, or choose to skip the question completely. Here's a breakdown of what programs can see. If an applicant selects a geographic division, programs within that division will see the preference and the applicant's explanation. Programs outside of that division will not see any information displayed. And if an applicant indicates they have no division preference, that information and any explanation provided will be visible to any program to which they apply. And for setting preferences, applicants can express a preference for urban or rural settings, provide an explanation, or skip the question. Programs will have access to the setting and explanation selected by the applicant. These preferences aim to provide programs with valuable insights into the applicant's interest. And next slide. So on to more operational pieces for this upcoming season. The following sections have been standardized and or structured. So we have higher education, honors awards and memberships, medical education interruptions, and board and healthcare related certifications. Additionally, ARIS will collect only languages applicants have good or better proficiency, including English, and reduce the limit on hometowns from 5 to 3. And also hobbies and interests are being collected again in experience section as a standalone question. And next slide. So here we have our opening dates. So on July 3rd, applicants may begin submitting applications to programs at 9 a.m. Eastern Standard Time. And on July 17th, July Cycle Fellowship programs may begin reviewing applications at 9 a.m. Eastern Standard Time. And I can also drop the link to the timeline in the chat as well. And next slide. So speaking of programs, there's a couple of pages I want to highlight. The first is participating in specialties programs page. Here you can find participating programs that are offering positions and links to their programs' websites. Additionally, ARIS asks specialties to place their specialty-wide requirements like standardized letter templates or additional information about that specialty in the additional information report linked at the bottom of this webpage. And I'll pause here if anyone wanted to scan the QR code. Okay, and next slide. In each season, we encourage programs to enter program information that is relevant to applicants, like program-specific document requirements, criteria they're looking for in applicants, or just overall important information. And this can be found when applying to programs in MyAris. You would click the program name, and that information would appear. And next slide. As the season concludes, we have interviews and the match ahead. 3 important points to note are basically to ensure all necessary documents are sent to programs. Regarding interviews, programs have various scheduling methods, so seek clarifications on their preferred workflows and familiarize yourself with interview etiquette, such as basically you would want to research your program to make sure that you know what they're using to interview applicants and they have the correct interview etiquette for a successful season. And lastly, the match event serves as a reminder that the NRMP and ARIS are separate entities. So research both organizations' sites, and additionally, ARIS will host a webinar, as I mentioned earlier, on June 25th, covering basic information and providing in-depth guidance on the application process and document uploads. And next slide, please. Now we'll review what applicants can expect for Thalamus in ARIS 2025. So all Thalamus products are entirely free for applicants. Majority of program interviews will be managed in Thalamus, including virtual, hybrid, and in-person interviews. There are web and mobile-based versions available to schedule interviews anywhere, anytime. And if you do have any problems with downloading the app or any technical questions for Thalamus, I would reach out to Thalamus directly. They have a great customer service team that can help support you guys in this process. And lastly, ARIS integration enables early account access. And next slide. So let's take some time to go over available resources. And next slide. We have various resources like timelines, the user guide, FAQs, and even a checklist for you to keep track of during your application season. You can find these resources on our ARIS Student Hub, which will be linked in the chat. And keep an eye out for these resources, especially in early June when we turn over the new season and update the content like the MyARIS user guide for the 2025 season. And next slide. And can we go to the next one? Thank you. And here we have our QR codes. I will pause here a bit so that you can take a picture and scan the QR codes and maybe save the websites if you choose. And we have the supplemental ARIS application data and reports QR code. We have what's new in the 2025 MyARIS application and the MyARIS application and program signaling for ARIS 2025. And I'll go ahead and pause here for a second. And we can go to the next slide. And if you didn't take a picture of the previous QR code, I will be putting this information in the chat. And last but not least, I'd like to leave you with the contact information for our ASD team. As you can see, we handle more of the technical side of the process. If you have any questions regarding guidance or filling out the application or how to best represent yourself in your application, be sure to instead direct those questions to your supporting dean's office. And thank you. I'll hand it back over.
Thank you so much, Ms. Constantine, for sharing us the hottest goss about ERS and double AMC. Now we're going to move on to the funnest part of the panel, which is the Q&A section. So let me first introduce all y'all's panelists today. So first, again, Ms. Laurel Constantine, Senior ERS Training Specialist from the Social American Medical Colleges. Welcome, Laurel. Thank you for joining us. Next, we're going to have Dr. Adrienne Taylor. She is CL Psychiatry Fellowship Director at Brigham and Women's Hospital and Associate Director of a Medical Psychiatry Service at Brigham and Women's. We're very pleased to welcome Dr. Paul Desan, Fellowship Director at Yale, Director of Psychiatric Consultation Services, Yale, and current Vice President on the ACLP Board of Directors. Thank you so much, Dr. Desan, for joining us. We have Dr. Samuel Greenstein, a CL Psychiatry Fellowship Director at Long Island Jewish and North Shore University Hospital, and has the unique viewpoint of having done another career before going into CL. So thank you again for joining us, Dr. Greenstein. Dr. Raymond Young, CL Psychiatry Fellowship Director and Division Chief for Psychiatry CL at Emory. Thank you so much for joining us, Dr. Young. Dr. Tom Soprano, who is both CL Fellowship Director at University of Washington, Seattle, Director of Transplant Psychiatry at UW, as well as Chair of the ACLP Resident Education Subcommittee. Fun fact, he was actually the Fellowship Assistant Director when I was a fellow at University of Washington. So thanks so much for joining us, Dr. Soprano. Dr. Q Chang Lee, CL Fellowship Director at the University of California, San Francisco, the Chair of the ACLP Fellowship Education Subcommittee, and a Director on the ACLP Board of Directors. And then lastly, there's me. I'm an attending at UT Southwestern in Dallas, Texas, and I'm co-chair of the ACLP DEI subcommittee. And I'm also a new dad, so if you hear a child yelping in the background, he's fine, he's thriving. All right, so now time for Q&A. I'm gonna stop sharing right now. If you'd like to ask a question, just use the Q&A function in the chat and we'll answer questions as they come in. I'll also be peppering in just questions that we got ahead of time, just to keep things moving along. So first question, Dr. Sarah Nash from Columbia. I am so sorry, like the slide somehow got left off of the slide deck. We'll make sure to put it in. Thank you again for joining us, Dr. Nash. So first question for the panelists. Why do you see a psychiatry fellowship?
I would say, why not do a CL fellowship? It's it's such a great excuse me, I also am a little bit hoarse, but it's a wonderful opportunity. I think it's 1 year, which is not asking anyone to, commit to a many-year program. It's 1 year. You learn a tremendous amount. You get a lot of exposure to different things within CL psychiatry. It sets you up if you want to be a CL psychiatrist. It sets you up if you want to do something adjacent to CL psychiatry. I think what all the other program directors here know is that CL is the most fun part of all of psychiatry. So I would say you should absolutely consider doing a fellowship.
Coming towards the end of the year with our current fellows, I recently had the opportunity to ask them what they thought the answer to this question should be now in retrospect. And I think that universally, I hear the same thing year after year from fellows, and they often tell me that they were surprised by how much they actually learned that they still didn't know. And that's always a humbling and really inspiring process. They also talked about their opportunity to consolidate a lot of the learning that they did in residency. You get to see a lot of cases, but you don't always have the time to reflect and do some more deeper dives into the literature and backing up a lot of your decisions in that aspect. So that really helps you grow as a practitioner. And then I think especially, at least at the University of Washington, we like to focus a lot on leadership skills and teaching skills. There are things that are not as frequently taught in residency unless you take on a leadership role. And even then, so it's not often done so formally. So that's what I think the at least strengths of the doing a CL fellowship are, and especially having heard from my recent fellows.
Yeah, I'll just add that in addition to time to really delve into more complex cases and really think about what you're doing, it's really an opportunity to build a mentorship network in a way that's much more difficult during residency, that you really spend a lot more face time with your attendings, with people who share your passion or your interests in CL psychiatry. And I didn't think about this prior to choosing the specialty, but it's really a fantastic community. We're not a huge community where it's a community where we get to know each other well. If you're, for example, involved in ACLP, and it starts with a fellowship and with their mentors and your attendings, and it's really an opportunity that is, I think, really well worth considering. So I just add that piece of it.
Yeah, so I think I agree with Sarah. I agree with Tom. I agree with Q. Why not do a CL fellowship? And yet, this is going to maybe sound a little contrarian. Initially, I didn't. I think what makes my story a little unique is for 3 years I was a CL attending at University of Cincinnati, fresh out of residency without a fellowship, and then I went backwards and did a fellowship, and I don't regret it at all. And one of the main cases is if you want to be, and if you want to stay in an academic space, more and more you're going to need to do that fellowship regardless of your regardless of your essentially your previous experience. And then to what Tom and Q and Sarah have said, it gives you another year to kind of add more depth, if you will, or breadth, depending on what you're looking for your own personal experience. I mean, I certainly appreciate that every person has their own reasons to potentially not, as it was already alluded to. Cost of living is extremely expensive, and attending salary is a very legitimate, reason to potentially try to skip a year of fellowship if possible, especially if you can maybe get hired as a CL attending. But most places allow you to moonlight, and 1 year goes by really, really quickly. And if it's something that you're thinking about, especially in the academic space, I think it's an invaluable experience.
Awesome. Thank you all so much for answering that question. And that actually touches on the next question Dr. Grimson was going to ask, which is we get asked every year perennially, like, can I just do CL without a CL fellowship? So I'll let you take the lead on one, Dr. Grimson, but please, rest of the panel, weigh in on this. Can I just be doing CL without the fellowship?
So I think it really depends. And certainly we have I know Sarah's in the Northeast as well, Adrian's Northeast. We have a couple of Northeast people. In the Northeast, it's going to be really, really challenging to do CL, especially inpatient CL without a fellowship. Maybe you could do a subspecialty clinic if you demonstrated some impressive experience. I imagine out West that may be similarly difficult. Midwest gets this rap of maybe you can, maybe you can't. Again, in an academic space, it's harder, especially if that program has a fellowship. So University of Cincinnati does not have a CL fellowship, and and that I think was just a unique opportunity for me. And I moved there for personal reasons. My wife was in fellowship there in a different division. So I think maybe in community hospitals you can, but you know, I'm curious what other of my colleagues would say.
This is Ray Young from Emory University. I mean, yeah, the practical answer is yes, I think you can. I mean, the reality is there are more positions available across the country where there's just a need for people to serve in this role and just not enough people doing fellowships. So in the practical sense, yes, but I do think, like everybody has talked about with the first question, I do think you miss out on a significant skill set in terms of developing the clinical experience to deal with significant medical psychiatric complexities, and also having a better understanding of hospital systems. You know, we as CL psychiatrists represent the face of psychiatry and often are the main branch of psychiatry to the interworkings of the hospitals. And so we're often very much involved in hospital leadership. And I think doing that CL fellowship will give you the skills to be able to do that. I'm not going to say that not everyone has to do that, but I think if you really want to develop that skills, whether it's in academics or pursue hospital leadership, I think doing the CL fellowship is really key.
Yeah, and the other thing that I'll just add is I kind of agree with both points, and I think that trying to get a CL position without a CL fellowship you might just like have limited options. Like the options might be there, but they might be limited. And I think like kind of like whatever everybody mentioned, it might be limited geographically, and that like some parts of the country are really going to expect that you have a CL fellowship. I think that even if you are somebody who is kind of like specifically looking at community positions, a lot of community positions are being either like attached to larger academic position or larger academic hospitals. And so there still might be kind of that expectation that you have some sort of formal CL training prior to going into that job. And then I think it might limit your access to different positions that you might be interested in, whether that be a leadership position or some sort of administrative position, because as was mentioned previously, you might not necessarily have the skills kind of coming into that job that you would have gained while you were doing a CL fellowship. So you might not have, I guess, the credentials or experience to pursue a job like that straight out of training.
I just wanted to add, oh, go ahead, Tom.
Okay. Thanks, Sarah. Speaking from the West Coast and then also kind of covering a more large geographic region than most of our folks from the East Coast do, the University of Washington kind of branches up into Alaska, Montana, Idaho, Wyoming, and so forth. And so we have a lot of these like kind of spoken hub systems and training a lot of providers who actually end up planning on working in rural settings. I actually have found that fellowship training is in some ways even more important in those settings. Oftentimes in these community settings, you are like the only mental health practitioner, or at least the most trained individual. And as I think he was talking about, having a community like the CL community is just so important. And coming out of residency, it's you don't have that same sort of network because it's in a way too big. And a lot of our colleagues who train in our fellowships and go elsewhere kind of connect back to us. If there's a really tough case, it's wonderful to have the support of a bigger institution if you're going out into the community. Can you be a CL psychiatrist out in Wyoming? For sure. But you'll want the kind of the other components of fellowship that are, I would say, are even more important in some ways.
And I 100% agree with what Tom just said and what everyone else has said. I wanted to throw one other thought in there, which is that, I think Sam is unusual in the sense that he went back and did a fellowship, because I think for a lot of people, if they don't do the fellowship up front, they don't do it. And that's for a lot of reasons, including where you are in your life and where you've settled and what you want to do. But I think it's also very hard to go from an attending salary to a fellow salary, even if it's just for a year. So it may, again, depend on if you're partnered, what your partner does, and what your sort of combined income is. But I have found that people who have said, you know, I'm going to go and I'm going to work for a little while, and then I'm going to maybe come back and do a fellowship, have typically not come back and done the fellowship. And so this is actually a really wonderful moment to kind of take advantage. It's an extension of the training. It provides you with this opportunity to really master and, you know, kind of hone your skills, and then you can go out and do all of these things. And I think even, you know, whether you're in a rural setting or an urban setting, having that extra training is incredibly helpful. And I cannot underscore how important the community is. And we're just so lucky as CL psychiatrists. And I think kind of no matter where you are in the country, you have this great community. So it's almost worth doing the fellowship only to be part of that community, even if you're doing something else. It's a fantastic community.
Awesome. Thank you so much for answering that really informed question. Another big one that's come in as we're waiting for questions to come in the Q&A. Again, y'all, don't be shy. Like, this is a super chill bunch. All right. But a question that's come up a lot is, how do y'all recommend evaluating programs and whether or not to apply to them? Like, what are the things y'all recommend applicants look for when looking at different fellowships?
I'll take a first stab at that, and thanks, Sarah. And real quick, I don't want to spend any more time on me. I certainly wouldn't advise after being an attending for 3 years to go backwards. It was a very unique scenario, and I kind of thought this may happen for me personally, and I would encourage people just to go straight. With that said, again, if you're giving a year back to fellowship, you want to really make it worthwhile. So you want to think about a program that is either really dovetails with your personal interests or has a robust clinical experience that you feel if you want a bread and butter CL experience, that you're going to get that you're going to be able to stand on your own 2 feet. So again, I would say it depends what you personally want, but think about a program that's going to, I'm not saying work you to the bone, but where you're going to really get good clinical exposure and you're going to feel confident. Because when we think about the fact that a year later, it's going to be you making these decisions, you know, hopefully in this great ACLP community, which I can't say enough about. I'm on Tom's residency education committee. I love going to ACLP, but regardless, it's going to be you as the attending and you want to feel confident. So I think going to a place that you feel will give you that experience is really paramount.
I think the other thing that I would add to that point is not only like thinking about a place where you can go where you'll be able to get like a lot of cases or a lot of experience. And it might also be helpful to think about a subspecialty interest that you might be starting to develop. And kind of along those, so like, does that fellowship have access to that? Do they either have a way to see a lot of cases with that and on the inpatient setting, or like an outpatient clinic that you can get involved in? But then I think also along those lines, if there's like somebody that you have really admired or really, you know, feel like the type of work that they do is like something that you would want to do in the future and you would like to get mentorship from that person, then it might be, that might be like a helpful way to start to like narrow down or like think about the different fellowships that you might want to apply to and then interview.
All right, and so building on that question for the panel, how do y'all make decision if, especially if your home institution has a fellowship program? Do you stay and do fellowship at your home program? Do you purposely go somewhere else? Like, it's tricky and awkward, which is why I'm asking it instead of one of the applicants having to ask it. So what do y'all think?
I think this plays into the previous question to some degree. I think that you should first and foremost choose your life. Do something that works with what you're thinking about for your family and yourself and your career. Fellowship often does launch you into where you will end up working. Most people end up working and living in the place where they last trained. So I always tell people you have to be careful where you train last. But I think that you can't make a bad decision actually in this aspect. It's great to have some diversity and go to a different program. And it's also great if you know, if you're at a place you love, to kind of double down and kind of set up a runway for the future. You really can't fail.
I think to Tom's point, if you know, for instance, that you want to stay at your own home institution for a full-time career, why not stay? But if you think you want to go to a different hospital, maybe target that hospital for fellowship. All this is very personal and you know, situation by situation dependent, but I think there's no real right or wrong answer as long as you have a good reason for what you're trying to do.
And you know, I think that your attendings or your fellowship director at your institution want that for you. Like we want you to go to the place that's really going to help you thrive both personally and professionally, so that there's no reason to feel compelled to stay at your own institution, I don't think.
And I think to Q's point, like, don't be afraid to let your faculty know, your mentors know what your thoughts are, like what you might be interested in looking at, because then they can like help you as you're going along the process. They can introduce you to people. Like we've said before, like ACLP is such a fantastic community, but it's also like a small community, and we all like know each other and kind of like work together. And so they can make those connections for you so that you can meet people, ask questions before you're starting to go through the process or interviewing at different institutions.
This may tie into another question later, but I think even if you feel very confident that you want to stay at your home institution, and even if there is confidence that they want you to stay in return, I would still apply. I would apply to a bunch of places that look like they might be good places to think about. And in part, that's because you get to meet the community. You get to start to meet both the people who will be on your fellowship day, who will be kind of on track on their careers with you. You get to meet faculty at a lot of places. And I can say that, you know, we have a pretty big division at Columbia, and we don't have a ton of turnover. So sometimes we don't have jobs for our fellows when they graduate, although we would want to hire every single one of them. We can't always. And sometimes we have jobs when we don't expect it. And the first place we go to look is back at the people we interviewed and the people who applied to us, who we thought, this is a really interesting person. This is someone we would have really liked to have been here, even if they weren't our fellow. So it's always good to have made those connections. And then those are connections you continue, especially if you get involved in ACLP or through the APA and the CL community, and you kind of maintain those relationships. It may have really wonderful opportunities for you later on. And so, you know, I strongly recommend that if you know that you're going to be in one city and there are 3 other places in that city, that's not so many applications. If you're talking about the entire country, then that's too many and you have to narrow down.
Thanks, Dr. Nash. That actually brings me to a question that I'm going to direct to Laurel first. First of all, how many programs should applicants be applying to? So Laurel, is there like a cost per program? Is it like the first however much or this much? And then for the panel, how many programs should applicants be applying to?
So for ARIS, we don't really put guidelines on how many applications applicants should send to programs, but I can give more information about the cost of the programs. So I know for residency, the fees were based on the number of programs applied to per specialty, but for fellowship applications, the fees are based on the number of programs applied to across specialties. So it's not per specialties for fellowship applications. And for example, up to 10 programs, you would pay $115 base fee. And then 11 to 20 programs, it'll be $17 each. 21 to 30 programs, $20 each. And then 31 or more programs, $27 each. So as you can see, it's kind of a tiered structure. And as for how many you should apply to, unfortunately, we don't have any guidelines for that.
This is Ray Young from Emory. From a program director's standpoint, I wouldn't have any specific number for applicants in terms of what they should or shouldn't do. I think people should apply to programs where they think they want to go based on their interests, based on where they think they may want to live, just based on ultimately what they think would be the best fit for them. I mean, the reality is, although the programs are becoming more competitive, there's still more positions nationally available than there are people applying. So the advantage is to you, the fellowship applicant. So, I think you should apply based on how you think you would fit in based on your interest overall.
I think that it really depends on how strong of an applicant you are. I generally tell my trainees to actually not apply to more than 5 programs. Matching is in the trainee's favor, and that's great. You know, you can distract yourself with a lot of different places that you know that you don't actually even want to live, and it's best to not distract yourself too much if you know you don't want to go to some place just because of a program has a good name or something. You should, again, think about what your life is going to look like long term outside of medicine.
And this is where I think getting good mentorship and coaching it could be really helpful, because I think it could depend, at how strong of an applicant you are. So a couple of plugs. Certainly, I think talk to your own personal program director, but also maybe consider getting involved. I mean, we have the mentorship program, I believe, and that would be a great question to ask. Honestly, let the mentor, if you're, your ACLP mentor, know your stats, your scores and all that stuff, and see what they say. And that could be really helpful.
Awesome. Thanks so much, team. Actually, now transitioning more into the applicant side of things, we got this question as a direct chat to myself. Hi there, I've got a question. What advice would you have for someone in a smaller name Community S residency program who would like to go to a bigger name institution for fellowship? I'm wondering what my colleagues and I can do to make our applications more competitive without having much research present.
I don't think research is a requirement at all. I think we really take into consideration where you're coming from and what you have access to. Smaller programs often do not have access to certain things that bigger institutions do. I think you just have to demonstrate that you are a really good hard worker and you've learned all that you can in your institution and you want to expand beyond that. I think getting involved in organizations like ACLP early and talking to people and knowing various people can be really helpful, because often if you have a lower resourced organization or a smaller organization, you might not have the connections. But once you get like even just a pinky into the organization and ask any one of us for some help and guidance, we'll connect you with anybody that you want to talk with. It's pretty a low barrier of entry.
I agree. I mean, I think research is wonderful if you like to do research and you want to have a research career, you want to have a part of your career that's involved with research, but it's not mandatory. And I think one of the things that can be helpful is letting programs know that you're very interested in going someplace different from where you are, that you want to sort of expand, and maybe identifying something within that program that particularly speaks to you. And then this is pretty general, but really explaining why you want to be a CL psychiatrist and why you think being in the place that you're trying to go to would help you do a better job of that, regardless of maybe where, even if you don't know what you want to do ultimately. If you want to stay, if you're coming from, say, a rural setting, you want to go to an urban setting, you don't know what you ultimately will want to do, urban versus rural versus suburban. I think that, certainly when I'm looking at applications, I'm really interested in who this person is, how they might fit in with our team, what it would be like, what they're interested in, and really wanting to make sure that we want to train people who want to be CL psychiatrists. So I think being able to demonstrate that this is really what you want and why is much more important than if you have, an enormous number of publications or other things. I mean, you want to be yourself.
Yeah, I agree with Sarah and Tom, and I don't identify as a researcher. I identify myself as a clinician and educator, and I always have, and have been very happy in that career. So I think, again, to me, really, probably the most important criterion is somebody who, a candidate who shares my passion for this fantastic field. So I echo what Tom and Sarah said.
Thank you. Just moving on to the next question in the chat. The ECLP website's fellowship program pages list the number of covered beds per clinical site. Some programs also list the number of consults per fellow annually. In general, does more covered beds equal better? Does more clinical sites equal better? Are there benefits to lower number of covered beds or fewer clinical sites? Does this just come down to whether you're looking for depth versus breadth? It's a really interesting question.
And just to add more noise, that doesn't the website doesn't really address how many other learners are part of the CL group, right? So even if there's X number of new consults a day and there's Y number of covered beds, what if there's a bunch of learners, not just the fellow? So I think the answer is not really a great answer, but it's during the interview process, get a good feel for what that means at the program that you're applying to. I don't necessarily think it matters one way or the other. I mean, our fellowship is a 2-site fellowship. Both sites have many, many hospital beds. Very, very busy service. Is it possible that a smaller program has better experience? Absolutely. And I say better in terms of robust clinical teaching and having their fellows feel really competent afterwards. Sure. I don't think it necessarily matters.
I agree with Sam. I wouldn't put too much weight on those numbers, but I think you can use or leverage those numbers to ask about a program's values, because you can have a few cases, and if attendings are really into teaching and learning, and you can go really into depth in that, that is very valuable. On the other hand, maybe you do want a wide volume, so it can, as you suggest, give you some ideas about how much opportunity there is. But again, it really comes down to a much bigger global picture, like how many hospitals are even in a given area? Do all of them get funneled into one hospital versus another based on, patient population or, disease etiology and so forth? So it's really confusing. Yeah, I'm not sure I would pay too much attention to those numbers.
Yeah, I would just say there's a distinction between exposure and education. They're not the same.
Thanks, all. Next question in the chat was, is CL fellowship amenable to like QI type research or other options for research? And then what's the significance of the conference, like ACLP, like attendance, prior to applying for fellowship versus going after fellowship? So let's first talk about like what are opportunities for research within CL fellowship.
So I think a lot about research is having an idea of what you want to study and whether or not you're coming in with a specific idea of your own, a project that's already been started. If you're interested in joining into projects that are already ongoing, I think for a 1-year fellowship, it is really hard to come in saying, I have this idea, I need to get it through the IRB, then we need to do it, then we need to publish. There's just not enough time because the IRB process can take a while. And especially if you're going to a new institution, you have to learn the system. So that can be very difficult. But if you're applying and you're thinking, what do the faculty here do? Oh, there's someone who does this kind of research. And maybe you meet with that person when you're applying and they have projects and you can join a project as a fellow. I think you can get a lot done. You just have to be thoughtful about the way you're doing it. Related to quality, I think quality projects are great. Often their quality projects don't require going through the IRB. And so you can actually jump in and get started if you have an idea. So we've had a number of projects that people have done in the past, both faculty and fellows and sometimes residents. And so I think those are wonderful types of research questions that you can ask. And that not every research question has to be answered in some enormous research study. So sometimes you can have an idea You can do a pilot and do that during your fellowship. And then depending on what your data is, you might expand that in some other ways as you go beyond. The last thing I just wanted to comment on regarding the ACLP and attending conferences, the ACLP is really fantastic because it's really interesting, but it's also not enormous. And I think it's a great opportunity to come and meet people. If you have the chance to go as a resident, which many residents don't because residency is incredibly busy and schedules are not necessarily your own. Doesn't look bad if you haven't been. We feel ACLP is really important. We think of our didactics both sort of locally and nationally, and it's actually mandatory that our fellows go to the ACLP. And I think many other programs do that, and many programs pay for their fellows to go, and you can ask program by program because we think it's very important. And then we hope that people will continue to go. I think if you get your foot in the door at the ACLP and you're really someone who wants to be a CL psychiatrist, you're going to be hooked. Some years you're going to go, some years not going to go. Sometimes that's going to be because there's a clinical service at home that has to be covered. You may have to do that. Sometimes it may be in a place that's far away and hard to get to. And there's the aspects of your own life. You know, do you have young children? Do you have other responsibilities? But I think overall, the ACLP offers a lot more than just the meeting, but the meeting is wonderful. So there are lots of ways to get involved. And you shouldn't feel like if you haven't gone to a meeting yet, or you haven't joined yet, that somehow you're behind the 8 ball. There's lots of time to join, to become involved. And I think learning about it is the first step.
Thanks, all. Anybody else on the panel? Any other thoughts about taking part in ACLP, either like before applying for fellowship, during the fellowship application cycle, during fellowship itself?
Yeah, I pretty much agree with Sarah, not surprisingly, and again, not to repeat myself, but certainly for anyone on here that's not sure, I you know, about CL or just wants more mentorship there, more guidance. A lot of us on ACLP and certainly in part of that mentorship program are all about doing just that. So I think that could be potentially helpful. And then similarly, if you can get to ACLP during your residency, that may help you make your decision because it's a really unique conference. It's very intimate. And every year I go, I generally find myself inspired to do a new potential project. So I can't say enough about the Academy.
Big picture, though, I think maybe trying to get to the heart of where that question might be asking is, you know, is somebody going to count it against you if you don't go? No, not at all. It's only really for your benefit. So go if you think it's going to be helpful for you, and I'm pretty sure it will. But you know, nobody's going to say, oh, well, gosh, that person didn't show up to ACLP. They must not be interested. That's not.
Yeah, sorry about that. Totally agree with Tom. Yeah, and I certainly do not look at that as any indication of, oh, this person's not serious. People have lives, and we all get that, I think.
And then just one other thought, which is if you are someone who's doing research as a resident, or you've done a project, or you've done a case series or something, and this would be more for folks who are not about to enter PGY4 because the deadline's already happened, but the ACLP and other organizations too, but I would stick with the ACLP, really welcomes trainee posters, and I would really encourage you, if you have something, to submit it. And you can get mentorship from your home programs or again from the ACLP community, how to put things together if you've never done it before, because maybe there hasn't been an opportunity. And it's just a very warm and friendly place to get started. So if you're thinking about research, or it's another opportunity to think, hey, do I like this? Do I not like this? Or I've done a project, or what do I do with this project that I've done? I would encourage you to submit it because you have a very good likelihood of having a warm reception, and then deciding if this is what you want to do moving forward.
Thanks, all. Moving on to the next question. On the ACLP website's fellowship directory, for most programs that also list a number of full-time faculty equivalents, Is this a proxy for important program qualities or values?
Can you just repeat that last part? I somehow didn't hear the whole question. I'm sorry.
Oh, no worries. On the ACLP website's fellowship directory, for most programs also lists the number of full-time faculty equivalents. Is this a proxy for important program qualities or values?
I think it's very hard to interpret. You know, you can't tell from a number of FTEs how committed to education they are, how they split their time. You know, so I think that I wouldn't, just like with the BES, pay too much attention to numbers. That's the kind of thing you can get a sense of when you interview. But it's really hard to tell from a number on the website, is my opinion.
These are some really good points, and maybe we should provide some thoughts about how we change the structure of that, the website and some of those metrics. I'm glad people are bringing these things up. I agree with Q completely.
Take notes. Taking notes. Ooh, big question that just came in right now. Would the panelists, y'all be able to share your thoughts on the main goal of the personal statement? In other words, what are you hoping to learn about the applicant by reading it?
So I'm a pretty passionate person. I think that's usually the adjective most people say about me. I want to see passion. I want to really have a good understanding of that the applicant understands what CL is, the point of what we do. Even if the applicant doesn't have a lot of experience because of their residency program, that's fine. We can, a lot of us in the fellowship world can coach that up. But we certainly want to know that the applicant has a good understanding of what CL is, understands how we are a part of a bunch of different healthcare not just disparities, but crises, access, cost, quality of care, and that they want to be part of that solution. So I think if you can demonstrate that that you're passionate about that and you want to grow there, I think that's a great personal statement.
I think for me, the personal statement provides at least a small piece of who we're going to meet potentially when we're about to interview them. You know, I like learning about what is motivating them to do a CL fellowship. What is that passion behind that? What is it, a personal experience? Is it something just because of the rotations that they're doing? What is it about them that motivated them? And it's that spark that you see in that motivates me when I'm reading them, that I reach out to them. So I want us to get to learn more about them. So that's for me what I look for in a personal statement. It's just that passion, what's motivating them to do CL. Why do they want to do that?
I hope that in a personal statement you get across who you are, because that's really important. It makes you different from the other applicants, and it also tells us why this is important to you. A couple of other just very practical issues with the personal statement and really your application as a whole. Please proofread it, because one of the things that's a pet peeve of mine, because I'm reading a lot of applications, is if you're applying to Columbia, it's spelled like the university, not the country. That's number one. And if it looks sloppy, that doesn't bode well, right? And it may, you know, it shouldn't look sloppy, because I think people are putting time into it. You want to make sure that it reflects the time you have put into it, and that you are thoughtful about it. We know that sometimes these applications are going to multiple places. So please, you know, I when I was applying to medical school, I caught a very potentially bad error before I sent the application, but it was to a program in Boston telling them how much I wanted to be in New York. So you definitely don't want to do that. And you know, you want to make sure that everything is together. And I think, while, you know, one of the things that's nice to show is that if you like to write, your writing style can come across, and that's fine. It's also fine if English isn't your first language, and you're writing. We understand that. I think somewhere, if English isn't your first language and you're a little uncomfortable in writing in English, maybe let us know that you have other language proficiency, because I think that that's a helpful thing. figuring it out. You know, we don't expect to read it like a medical chart. We do want to make sure that, you know, the ideas are synthesized together, because how you write an application gives us some sense of maybe how you think about things, which may go into how you think about a patient, how you formulate, how you write a note, how you communicate. So I would be thoughtful, I would be careful, I would proofread, and then maybe have someone else look over it as well and give you some feedback and make sure that it all flows very nicely, because then it presents you in the best light, and we really want to see you in your best light.
Yeah. So, next question. I want to understand the bandwidth required by programs to review applicants and how concise my own application should be. Would y'all be able to share rough estimates of recent number of applicants, granted interviews, and number of fellows? So I'm just going to editorially say that, like, good luck to y'all. Like, I will never be able to find that out about people's programs, because that's proprietary information, and it depends on so many things that not even programs know. So if we can make, but at least could y'all answer the question, like, what is the review process like for fellowship compared to like residency or medical school? Like, how holistically do y'all look at applications, and how concise should applicants be?
I think the fellowship directors have spoken pretty openly about this as a group, and we all read everybody's application through end to end. And we probably invite most applicants, so it's very unlike residency. So that's my short answer.
So going back to I think what Sarah said and Raymond, like, this is your time to shine. I don't think you have to worry about being concise or think about brevity per se. Certainly don't want to necessarily be verbose in the personal statement and long-winded, but this is your time to shine. And yeah, I think the majority, I don't want to speak for the majority, I'll just say me, I'll look at every single application. So, and I think a lot of us do that.
It's probably helpful to know that I think there's something like 100 fellows per year, so somewhere in that ballpark. So, you know, even if every person who's going to take a fellowship position applies to our program, that's 100, you know, applications, which is much less than what residencies are dealing with. So
I also don't think that fellowship programs have sort of screen outs the way that many residency programs have to, because the residency programs will get thousands and thousands of applications. So really everything does get read. And I don't think I can speak for myself, but I think I speak for other people too. It's not like you read the cover sheet of the common CLP application or the cover sheet of ERAS, and you look at it and you say, oh, this person didn't score high enough, I'm not even going to look at the rest of this application. Or, oh, this person didn't go to one of, you know, 25 different medical schools or 25 different residency programs, so we're not interested. We're really interested in who you are, where you're from, what you've done, what you want to do, and kind of what's going on now. You know, one of the things that was on a slide was earlier that Chandan showed was, you know, the medical school dean's letter. So if you include it, I will read it. But quite frankly, I really don't care about your medical school dean's letter, because if you were great in medical school, that's great. And you went on to be great in residency, that's great. But if you weren't great in medical school, and then you were great in residency, I don't want to know that you weren't great in medical school. I'm very happy that you were great as a resident. So I think you should be thoughtful about the things that you're submitting. You want to submit things that make you look in your best light. So, you know, there are a lot of people who've gone through things in their lives, and maybe college or medical school, it wasn't their best moment, or they had trouble getting into medical. But what have you done where you are? And how can you show us who you are and why you're terrific and why we should want you? Because we do want you. We want to grow our field. So tell us, you know, and don't worry about too many other things, or trying to sort of analyze it, or what are we going to like, what are we not going to like, where are we going to read, or what are we going to throw away? We really want to like you, you know, so I think you're starting from a point of strength.
yeah, building off what Sarah was saying, it's really a buyer's market. I think you should find the program that's best for you, and there is one, at least one. There's probably more like 10. But actually, all of us, I don't know, I'll go out on a limb and speak for all of us, at risk of being very, very wrong. But I want people to go to my program who will do well here, and then I want people who will do better at Sam's program to go to Sam's program. I don't want to. There is no like best. I think it's where you need to be.
And Dr. Nash, just to clarify, I included Dean's letter on the list because I was just like super anxious applying for CL fellowship back in the day. This is before ERAS. So I applied to a whole bunch of programs, and just random programs asked for like my medical school diploma. So I had to like fish it out of the frame and scan it. One asked for a Dean's letter. One asked for transcripts. I had to like go back to Pittsburgh and be like, hey, can I have my med school transcript from all those years ago? So again, this is just an opportunity for y'all to ask programs ahead of time what they need. If they need specific things, just ask for it. But by no means do you need to send it for everybody.
Right,
So this-
absolutely. And there may be programs that want it, and if they want it, I'm sure they have a good reason for wanting it, and then it's good to send, you should send it. But I'm just saying that, be who you are. We are better. I see one of the questions in the chat is talking about going back and what you would tell yourself if you're applying to fellowship now. So many of these things don't even apply, because I think what I would love to tell myself is, don't worry, someday there's going to be a good system that's going to organize all of this for you. And it's not, and there's going to be a match, and there's going to be all that, which there wasn't when I was a fellow. So I do think that, Chanda, to your point, like it's relevant for some people. And if it makes you look good, that's great. But I would just say, don't send something if it might make you look less good. Because if you look good with what you've got now, that's great. You don't have to show us that there was something that you've overcome unless you want to. But then explain it, and then tell us why that's important. Because maybe that really is critically important. Maybe that's something important about you, that there was something going on, and we should know, because this is how you've dealt with an adversity or a challenge. That's fine. But if it's just for the sake of adding paperwork, then it's not necessary.
Thank you, Dr. Nash. So actually, for opening up the rest of the panel, like, what is one thing you wish you could go back in time and tell yourself when you were applying for CL fellowship?
I'm old enough to have been grandfathered in. So I didn't do a fellowship. So I can't answer the question.
Yeah, same here. Can't answer it.
I think the thing that I would add, just to kind of like echo Sarah's point, and maybe like other points that have happened earlier, is just being really mindful and thoughtful about the different like programs that you want to apply to, and don't feel like you have to apply to. I think like one of the things I was really anxious, worried about was like applying to a bunch so that I could like open my opportunities up. But like everybody said, it's such a buyer's market. So just like being very like critical and mindful about like the number of programs that you're applying to. Like, don't necessarily distract yourself with other programs that you're not going to go to, and just kind of like give yourself the opportunity to focus in on the programs you really think that you're going to excel in.
I think if I could tell myself one other thing, it would be to try to enjoy the process a little more. I think I was very nervous and stressed, like most people are when they're applying for something. But to really have confidence that, you're meeting people who want to meet you, you're doing something you want to do, you're sharing interests with these faculty who you're meeting, you're going to meet lovely other applicants along the way, and to try to take a few moments in the process to step back and enjoy it. And really allow yourself to sort of free yourself up and just kind of be who you are, and see where it feels right. I mean, because ultimately there's going to be a gut component to this decision too, because you're going to meet some people or see some programs and you're going to say, this really feels like a good fit. And there may be others that don't feel like a good fit. And it's not because they're a bad program or you're a bad applicant, but it's kind of what Tom was saying, that there are probably programs that speak more to who you are, where you want to be, what you want to accomplish. And we're basically ultimately interviewing people. We're looking for colleagues. So, I mean, I think that's where you are. It's a friendly audience. So enjoy it.
All right, so we have a little under 10 minutes remaining. So question for the whole panel, as well as Ms. Constantine from AAMC. Any common pitfalls in the application process apart from the aforementioned poor editing?
I don't know about any pitfalls, but just some tips that I can give is to really look over your application before actually certifying and submitting it, because as you may know, you can't go back and edit your application and make changes after certifying and submitting. So I would say to really take the time to review it, even if you want to print out a copy of your application to review it that way, because I know sometimes in the system you may forget which tab you were in or already reviewed, and just really make sure that you do review the information, as well as when you're applying to programs, double check that you actually assigned your documents that you wanted to assign, because I used to work on the help desk and we used to get a lot of calls where people would call in saying, oh, they didn't know they had to assign documents, or they thought they assigned certain documents. So just make sure that you go through all of the document tabs, whether it's the personal section, personal information section, sorry, personal statement, the additional documents, and your letters of recommendation, and just really make sure that they're all assigned before and after applying. So those would be my 2 tips.
Just one other thought as you're applying too. Sometimes things come up after you have applied and after you've submitted the application, whether you're going through ERAS or you're going through the ACLP form. And again, because we're sort of a family and they're not thousands of people applying and thousands of people, if you've published a paper or you win an award or something happens, let us know. Just send an email. You can send an email to the program director, to the program coordinator. I know, and I'm sure many of my colleagues do this. It goes into your file, whether it's an electronic file or a paper file or both. And it's nice for us to know, because things may come up, from the time that you submit to the time that you interview, or even after you interview, but before it's time to certify the match lists. And so anything that, again, helps us know you better and puts you in a good light, you should just feel free to reach out.
Yeah, I think in applying, I think the individuals I have seen who are not happy with the results of their match come when they haven't been really authentic to themselves and figured out what they want from a fellowship year. And then that often manifests in them representing themselves in the way they think that they should be instead of the way that they are and what they're looking for. So I think authenticity is really important, and taking some really significant time to reflect and saying, like, what do I want, and what am I trying to get out of this extra year? And because it is an extra year, it's for you. And treat it as such. It's okay to be really selfish about that year. We try to cater to that, honestly, make it worth your while, because it is taking a lot from from other opportunities potentially.
Right, so last couple of questions, because I have a little under 7 minutes left. For residents who are interested in the intersection of neuro and psych, how might doing a CL fellowship be more advantageous than a neuropsych fellowship? And this could also be applied to people sending questions about, like, people interested in both women's mental health and CL, or emergency psychiatry and CL. Like, when people have some interest, how do you decide to do CL versus something else?
It kills me a little bit to say this, but I think having board certification actually matters. I am all about the learning ultimately, but I think other people don't know what you've learned unless you do have a certain threshold that has been generally agreed upon. That being said, I think there are tons of CL fellowships who have focuses on neuropsychiatry, women's mental health, and lots of other fields, and you can get kind of your cake and eat it too, I would say. So just look for those programs. And if you have questions about that, ask any of us, and people can direct you towards those programs.
And then Last question, for the panel, second to last question, actually, I'll say. Is there anything that residents can do which can help prepare them for fellowship or help demonstrate for interest in CL for when they apply? Student council, captain of the sports team.
Yeah, I mean, I think if you certainly can, if your program has elective time, if you could try to do more elective time in CL, if that's available. But then if it's not available, if you're in a smaller program that doesn't have a lot of CL opportunities, to take advantage of this academy, right? So we have journal club, we have case conference, we have the the annual conference. It just shows when you're interviewing that you're serious about this, and you know, we're not going to fault you if you're from a smaller program that doesn't have these opportunities, and we're not going to fault you necessarily if you don't do the webinars or anything like that. But if you show, hey, I'm in a smaller program, but I'm going to this and I'm going to that and I'm trying this and I'm trying that, it shows that you're interested, and I think that could actually help you. And it also it's good for you. You'll learn more about what you like and don't like, and that's equally as important as demonstrating to fellowship directors that you're interested in, you know, CL.
You know, from my perspective, you know, I think, you know, people should just not be afraid if they haven't done any of those things. I mean, if they're interested, they should apply. And it may be at this point in time that you've finally decided this is what you want to do. And then you make a point to express that in your personal statement and how you came up to that decision. We never know exactly in a timeline when we're going to say that this is what we want to do for us, or this is what our specialty is. So I wouldn't stress so much about that. I mean, I think it's great that if people join the ACLP, which I think is wonderful. I think people should do that. You can learn so much about this specialty, but if you haven't gotten to that point, because a lot of times residents don't, I think you should just go ahead and apply. So if this is what you want to do, by all means do it.
All right, y'all. Thanks so much again, everybody, for attending. I have one last question for y'all as the panel. Just a time for shameless plugs and self-promotion. So I wanted to go through the panelists one by one and just ask you, what's one thing you really like about your own fellowship program that you encourage applicants to look into? So we'll start northwest and then move across. So Dr. Soprano, UW, what's one thing that you love about your program?
Do I have to say just one? We have a new psycho-oncology pathway, which is unique and I think the only one on the West Coast, so that's kind of special. And then also, obviously, the home of collaborative care and lots of other programs. And we have a lot of like supporting fellowships around that we collaborate with. So you kind of get a smattering of a lot of fellowships, especially for those who are interested in addictions and women's mental health and neuropsychiatry, like some folks were asking about. So sorry, I cheated the question.
All right. Dr. Lee, UCSF.
Well, like Tom, there are a lot of things I like about my program, but you know what? I'm just going to say, and it sounds like a cliche, but it's really true. I just love the people. I love our commitment to teaching. I love our shared interests in consultation-liaison psychiatry. And I feel like I'm like, of course, most fortunate CL psychiatrist in the world to be here. So that's what I would say. That's what I love the most probably about my program and the fellows that have come through. So that's my answer.
Oh, thank you. Dr. Raymond Young, Emory. What do you love about Emory?
I probably would echo what Q has talked about. I mean, what I like about I've been at Emory for 21 years and I've been the fellowship director for 15. And what I like being in this position is the passion working with the different fellows, working with our faculty. You know, everyone who's involved in our program loves to teach, loves CL. It's a great place. A lot of our fellows stay on as faculty. So I can't echo anything more than that.
Now my geography is getting a little hazy because I'm going to know. But let's go, Dr. Samuel Greenstein.
Yeah, so I think a couple of things. I mean, certainly, I really love the clinical experience at LIJ. I think it's an extremely unique hospital, and we really get to see it all. But furthermore, this is pretty unique. The chair of our department is a med ed guru in the medical education space. And to have him as the chair, and his name's John Young, is just such a unique opportunity, I think, for all of us.
All right, thank you. Dr. Sarah Nash, Columbia.
So I love the opportunities that we have in our program. And a lot of that is because of the people who are there. And that includes both the faculty, who are just amazing people, and the fellows who bring so much every year. And I think we're very lucky. Bigger is not always better, but we take advantage of being in a very big hospital. And we have a lot of opportunities. And I think one of the things that's been very important to me is to consider the fellowship as something that is really dynamic, because different fellows want different things, and we are lucky to have a lot of things. And so then it's about matching up those interests and seeing how we can build something. Similarly, this can also be a challenging feature of a program, right? Which is sometimes there are too many things, and then how do you pick which things? So I think I love having that dilemma. I love having the opportunities and the people I work with.
Last but not least, Dr. Adrian Taylor, Brigham.
So hard to go last, but I think I would echo a lot of kind of what people have said. I think one of the things that is very special at Brigham is, a combination of the people, the educational experiences. We also have an opportunity where we are serving a large hospital system, a large community, and within that we have the opportunity to have a large group of faculty, and so it's been so wonderful just to be able to work with those faculty. I am a former fellow of the program, so also learn from those faculty, as well as our fellows who are coming to join us. I think the other thing that really has been really special about the people that we have is the opportunity to kind of develop different liaisons or tracks that our fellows get to participate in. So within our fellowship, we have kind of two tracks. And so we have like a general track as well as a psycho-oncology track. So we get to work really closely with our cancer center. But then as we've kind of like developed with the various faculty that we have, we've been able to develop different liaisons that our fellows get to participate in, which I think is a really awesome experience and really gives fellows the opportunity to really dive into one of those subspecialties that Shannon was mentioning in his presentation, and really hone in on that for the year and work with the colleagues within that specialty across the hospital.
Awesome. Thanks, y'all. Just a couple last slides for attending, everybody. Thank you again so much for attending, especially to our panelists. Just some additional resources for y'all. So the APA has a whole CL Psychiatry homepage, as well as the Council on CL Psychiatry that myself and Dr. Hugh Tingley are part of, that help get CL issues in the general psychiatry space. ACLP has a whole residence fellow section, which includes the guide on becoming CL fellow, a directory that a lot of you have already found, as well as the common CL application. The ACLP Training ECP Mentorship Award for residents is due September 15th. And then we even have a trainee travel award and a web fellowship, which are both good opportunities for trainees, which are due coming up on July 1st. ACLP has an early career psychiatrist interest group and listserv, as well as we mentioned the CL Pen Facebook group, which has been a great place to learn more about CL. And then just wanted to throw a plug for our AAMC and ERAS colleagues. They have effectively utilizing my ERAS webinar on June 25th at 7 p.m. Eastern Standard Time. So thanks y'all for joining us. A special thanks to our sponsor, the ACP Fellowship Education Subcommittee, the ACP Mentorship Subcommittee, the DI Subcommittee, the APA Council on CL Psychiatry, James Rack and Anna Menefee, our ACLP staff. James Rack is actually going to be retiring after a long time for ACLP, so a special thanks for him doing one of these last things before he leaves us. Brooke Trainum at the APA, and our amazing panel, fellowship directors, and Ms. Laura Constantine for AAMC. Feel free to email myself, your moderator, at chandlan.kinda@gmail.com. On the left, you'll see my son, who was born last year, like literally right after this panel. He's learned how to point, and he wants you to apply to CL. So this event is part of the ongoing ASB mentorship workshop series. We will stop the recording right now, but I'll stick around for any other questions y'all have. Thanks again, and have a good night, y'all. Thank you, panel.
Hi, my name's Daniel Fisher. I have a military specific question that I was holding because there's so few of us that I know last year the Air Force opened up and started offering sponsoring to residents to psychiatrists to do CL fellowship. And there's some confusion about that in the process. I know for those two. Is there anything different that we should consider in our application process for military active duty applicants?
So actually, I think many of us interviewed one of your colleagues who's now going to be a CL fellow, Dr. Bernard, I think is his name.
Yep, Gary Bernard, and okay.
Actually not with me on the APA CL Council. And my understanding is, since the Air Force, it is an Air Force specific position, right? Like you're not having to leave and go to civilian world and then apply for fellowship like some of your colleagues.
Correct. We'll stay active duty Air Force, and it's sponsored by the Air Force. They provide funding, but it's just so it's kind of a it's a different type of scenario, but I'm grateful they're doing it.
Okay. So what I'll say is, if you could, this is actually a really great question, because this is honestly a pretty unprecedented situation. I remember back when I was applying, like Stephen Marcoux, who is now just a civilian faculty member at Chicago, he was Air Force, and the Air Force just literally wouldn't allow anybody to apply to CL. Like he had to like leave the military and apply. So this is actually fairly new for just America. So if you could just email me your question, I'm actually going to email it directly to the powers that be, not mentioning you by name, of course, but like, hey, what are we going around it? When we faced the situation last year at UT Southwestern, we were like, do we just offer them a position outside of the match? Because technically, you know, they don't need like Medicare funding, they get funded by military, like where do we go from there? So I promise you, we do not have a clear answer. But since there's going to be at least you and possibly other people, because it's two positions, right, from the Air Force.
Yeah, and like the Army trains their own. They have their military specific fellowship at Walter Reed, and there's funding for two. Now so it is a weird chicken and egg where the Air Force tells you which two of those will be in December. So we kind of anticipate that we might get picked, but we have to get picked by the Air Force first and then match. So it's a weird. Anyway, I will send you, I'll message you my.
And luckily, Q and Tom were literally heads of the subcommittees for resident education and fellowship education. So if anyone's going to know, it's going to be them. So I'll get back to you shortly.
And that is my email, and then I can message you as well. So thank you so much. Thank you. Yes, I look forward to the year. So.